And we're live. Hi there. My name is Meagan Clanahan. I am the co-owner of Houston Moms Blog. And I have the privilege today to introduce you to another leading expert from UTMB Health. It is our privilege to bring you this series each and every month as we tackle important topics that are important. I say important, but important to you as parents and as moms, and things that you have asked for, things that you want to know, and things that our experts can shed a very, very specific light to. So today I have with us Dr. Kalia. She is a general practitioner out of UTMB Health. And Dr. Kalia, thank you so much for being here. And I'd love if you could just share a little bit about your background and how it relates to what we're talking about today.
Thank you for having me. I am Dr. Kalia, and I am a family physician board certified here at UTMB, and I practice here in the Houston area. And most importantly, I'm a mom of a 3-year-old boy who's very active, and an aunt to a 1-year-old as well, who I'm very active with as well. I love family medicine. That's why I went in. I love seeing children and adults and seeing geriatrics as well.
Well, thank you so much for being here. I know you're a wealth of knowledge, and what we are addressing today is kind of, it's a topic that we all want to know everything about, and we so want it, but it always doesn't happen as easily as we need it to. We are talking about sleep today, and we are going to talk about aspects of adult sleep, parent sleep, age-appropriate sleep, all of those things. And I know that there's gonna be parents out there like looking at this video being like, sleep, what is that? Like, we don't even know what sleep means anymore. But Dr. Kalia is going to give us some great tips on how maybe we can better our sleep. So let's dive right in, shall we? As I have my large Diet Coke, which you're probably gonna tell me I should not have at 2:30 in the afternoon. So let's talk about why sleep is so important.
Sleep is very important as far as having the energy throughout the day, especially for children. It helps with memory retention and daytime, getting the activities in and learning. One of the things is with children in sleep, toddlers usually don't show up, they're sleepy when they're sleep deprived. They'll show up with attention problems or behavioral issues. So sleep is really important that we incorporate these habits as a child onto adulthood as well.
Well, and so I think that it's great that you mentioned that. A lot of times we'll be like, gosh, so-and-so, what is up with them today? And you start looking back and maybe even backtracking a couple of days and being like, they didn't sleep great the night before, maybe they missed a nap, their schedule was off. And I think we could say the same for adults, right? I'm definitely more on edge if I have not had enough sleep. And I'm sure you're the same. As a busy physician, you're married to a physician and you have a 3-year-old. So I'm sure you see that play out in your daily life as well, right?
Yes.
And so what are some optimal sleep times as we're looking at babies and toddlers and adolescents and our teenagers or preteens? I have 2 twin-year-old, I say twin-year-olds, 2 10-year-olds, twin-year-olds. I like it, actually. I'm gonna roll with that.
Twin-year-old sounds good.
I think it works. So they're almost like preteen-ish, and like my daughter thinks she can just sleep till like 10 on the weekends. And so let's talk about optimal sleep time for babies, toddlers, adolescents, into teenage, and then how many should we be getting?
So optimum sleep times for babies, newborns, we all know that they sleep the most. And I would recommend they sleep about 17 hours a day. And then as they grow a little bit older, the sleep requirements decrease to 14 to 17. Then it goes down to about 12 to 15 hours. And the need for naps is still present as long as they make that number. It's a middle ground. Every kid's a little bit different, and their minimum requirements are different from other children, but we need to make sure that they get the adequate sleep. Adolescents, the fact that you brought up tweens, they start pushing these sleep limits. They'll start drinking more caffeine, or they'll start have their technology, their phones, especially teen girls. I know they're probably on their phones at nighttime, which disrupts their sleep habits or routines. One of the things is in adolescence, you're going to start seeing that they'll start pushing boundaries and try to sleep in on the weekends. But I recommend you sleep at the same time every day and wake up at the same time every day to keep that routine going. And as we get older, our need for sleep, it decreases, but we still need about 6 to 8 hours of sleep a night. One of the other issues is when we notice sleep problems, that's when we know in adolescence, it would be depression or anxiety. Those can cause the whole insomnia issues, or if they're depressed, they're going to sleep a little bit more. So as parents, we need to make sure we are on top of it and we observe these differences.
That is so critical to say, because I know when let's say at the beginning of pandemic, I was sad. I was going into almost a depressive mode. And so my way was to like go take a nap and like escape the world for a little bit, definitely sleeping in longer. But then I was staying up late, and it was a whole thing. And so I think that's super, super important to recognize for our teens who are more prone to kind of that situational depression, that we pay attention to their sleep habits. So it's more than for them than just being cranky or hard to deal with. We're actually concerned with their mental health there, with sleep habits, correct?
Yes, ma'am.
Okay, so how do we increase the quality of our sleep? So I know sometimes I'll wake up and feel like, I know I slept, but I didn't sleep great. And for reference point, I'm 40. And so I feel like some things have kind of switched. How do we increase quality sleep for moms, for parents, or for kids in general too?
And this is a big term used in medicine, sleep hygiene. That's very important. One thing is we can decrease our caffeine intake after 2 p.m. You shouldn't be drinking Diet Coke at this time. So that kind of pushes you to staying up a little bit later. Once again, the screen times need to be no screen time they say 30 minutes. I usually do 2 hours before bedtime, no screen times.
Right.
And do not use your bedroom only for sleep. Your bed should only be used for sleep. There should be no TVs, no entertainment. You shouldn't have your kids playing on the bed during the day. So that way, your body knows this is the place that I go to sleep. And then you will go to sleep better. One of the biggest things is don't have a heavy meal before going to sleep, because that's going to mess with your sleep. And alcohol, even though alcohol helps some of us fall asleep sooner, but the quality of sleep diminishes greatly.
That is such a good point too. I know that, like, let's say if I have a glass or two of wine at night, I can fall asleep pretty easily. But I will find myself up at 1 or 2, kind of wondering, or I'll of course, wake up in the morning and not feel great. So that's a great point. I actually haven't heard the term sleep hygiene, but I'm going to grasp onto that. And I think that's so important to talk about the kids and their rooms being for sleep. Like if you have a way to have your kids go to a playroom and do something where they're not playing in the room, then they know their bed is just for nighttime. So I think that's an awesome point. We have spring break. Oh, go ahead.
Sorry. And I'd like to add, for children, sleep hygiene is really, really important. To have a routine about an hour, 30 to 40 minutes before bedtime or an hour before. You can give them a bath. They know it's time put pajamas on, dim the lights, kind of mellow down. Some children have bedtime routines with stories to help put them to sleep as well. And I think that's really good in sleep hygiene for children per se.
So that routine is critical. And I think we can apply that almost to adults and to as moms too. So when I'm ready to kind of start winding down, I shut down my computer, I go wash my face, I put a mask on, I get my book or whatever I'm going to do. So the same kind of applies to kids and adults from a sleep routine and hygiene standpoint. So we are coming up on spring break for most of us soon. And obviously with COVID still in our midst for now, I don't know how many people will be traveling, but I know some people will be, or they just won't have the school routine. So how do we mitigate the sleep deprivation that comes from vacation or having no school and then staying up all night and trying to get back into a routine? What are your recommendations there for us?
So once again, we don't want to ruin our routines, the sleep-wake cycle. Our circadian rhythm is pretty much built up. One of the things is you don't have to be 100% by the rules, but I would say 80% by the rule and 20% for flexibility when it comes to vacations. Especially with the little ones, you want them to sleep during their normal times and mimic the bedroom environment, such as having their blanket or the sleep environment they normally sleep in if you're going to a hotel or a relative's house. Another issue is the travel, especially traveling with young ones. The best idea I noticed for my son was when I would travel with him in an airplane to try to do the airplane time around his nap time. So that way he sleeps during the flight. And same with when we're traveling, I used to travel back and forth from Houston to my residency, and we would make sure his nap time was during the travel time so that they don't get fussy, they don't get cranky as well. For parents, especially when we're going out of time zone, the issues is adjusting to the time zone. I would recommend giving yourself the first day as a flexibility for jet lag or adjusting to the area you're in. The biggest factor for circadian rhythm is sunlight. So when you wake up in the morning to a certain time, you make sure you're exposed to a lot of sunlight. So your mind knows to be awake at that time, and you'll adjust gradually to getting into that time zone.
Okay. So you've said this word a couple of times and you may have mentioned the definition before. What is circadian rhythm? What is that?
So circadian rhythm is the sleep-wake cycle. Your body has a biological clock, basically, that tells you at this time, we're going to release some melatonin to fall asleep. And this time we're going to release some hormones to wake up in the mornings. And the circadian rhythm, that's why routine is so important, that it's set around that rhythm. And also with the circadian rhythm, this goes into another realm, but people who are shift workers, especially with COVID, what just happened, some of us are waking up a lot later and then working later. And what happens is in long-term sleep deprivation and messing with your rhythm can result in metabolic conditions such as hypertension, hyperlipidemia as well.
So you just hit on my next question, because I was going to say, what are the true risks of being sleep deprived? I mean, we've kind of touched on, being out of sorts or cranky or unable to pay attention, but these are actually life-lasting dangers if you go on chronically sleep deprived, right?
Yes. And I would recommend always going to your primary care physician and letting them know how your sleep is. Sometimes we are so busy trying to figure out, oh, you have blood pressure, oh, you have this, but we need to know that you're not getting adequate sleep or you're having disturbances. So then we can refer you to have a sleep study done and to have further investigation of what an underlying cause can be. Especially now that obesity is more prevalent, we're starting to see more obstructive sleep apnea. With children, you're going to see certain children, such as parents of Down syndrome or autism, they will notice sleep disturbances that need to be addressed.
So interesting. And I was just gonna say with sleep apnea, because that's almost where you're sleeping and you may not realize you have stopped breathing, but it is absolutely obstructing you from getting a full night's sleep. So talk to your doctor, share all of those things. I think that's the underlying message. Whenever we've done these videos, is like share with your doctor. They are just like you, and they want to hear everything that's going on so you can get a full picture of what your life looks like as a patient. um and this is going a little bit off topic, but it reminded me because you mentioned melatonin. So what do you think about like the occasional gummy melatonin if you feel like you need to grab a good night's sleep? And I know there's like kids melatonin now and adult, and what's your overall feeling about that?
I believe it's a good over-the-counter option. I think take some melatonin if you do have problems falling asleep, and it is more of a natural cure to things. Also, you can drink things like milk that kind of helps people fall asleep as well, because it has some of the chemicals in there that kind of transition into melatonin in your body.
Okay, so I think that's it, because sometimes we feel like, oh, I don't know if I should be taking this, but man, you get desperate for a good night's sleep sometimes. And I'll pour the lavender, the chamomile, whatever it says, sleep inducing in the bath. I don't know if that science is behind that. You tell me, lavender chamomile baths, is it good?
Aromatherapy, it does help, especially lavender. It helps you fall asleep. The soothing techniques, once again, it's about sleep hygiene, as we talked about. So
Yeah.
certain soothing techniques can help you fall asleep and relax a lot easier.
I love that. And I do love my nightly bath. So I just may have to not have my nightly wine with my nightly bath. Um,
No more
so
wine. Maybe in the afternoon, if you can.
there we go. I promise I'm not going to drink any more Diet Coke today. Um, so what advice do you have for parents? I know this is a broad topic, but what specific advice would you give to parents who are struggling with kids who are not sleeping or babies? You've been there. You have a 3-year-old. And so how can you help us cope with the non-sleepers?
So with the non-sleepers, this I can go off for hours about this, but a lot of parents do complain as well. So first of all, there's a term sleep training as well. And all of us have who have older children, we've gone through the phase of sleep training. Initially, the children need a lot more sleep, 14 to 17 hours for a newborn. And then eventually you want to consolidate because it's broken into naps. Then eventually we want to consolidate into a full night's sleep. Another thing about sleep training is there's a lot of theories out there about the extinction method, and then you let them cry it out, where you put them in their crib where they sleep, and either you can, as parents, let them cry it out and fall asleep on their own. They create these soothing techniques on their own. But for most of us parents, even I struggled with the full extinction method. So I had a modified extinction method where we put him to bed and then we check up on him in time intervals, about 10 minutes, 20 minutes. And the checking up, you just pat them on the back, but you don't pick them up because they don't want to know that they cry and then you're going to come pick them up, right? And eventually after 2 weeks, it should cause them to have a sleep routine. Now, toddlers, they will start resisting. They're going to start testing boundaries with us. And what you do is, at nighttime, they'll cry or they'll bug you or they wake up in the middle of the night to bother you, but you have to stick to the discipline and do not give in and let them go to sleep on their own as well. With teenagers, it's a different category. And like I said, it's a lot of more insomnia related and anxiety related, but you need to make sure that they sleep at the same time and wake up the same time in the mornings. Did I happen to help out a
Yeah.
little bit with that question,
No,
or?
that's good. So, I mean, especially for our mamas who are struggling,
Mhm.
I think just saying like we've all been there. I, you know, I think the baby who comes home from the hospital and sleeps through the night, the first night is like the rarity. That doesn't really happen. And it does take those routines. Are there any resources or books that you would recommend for parents of newborns specifically who are trying to start that whole sleep routine, or maybe they're 6 months in, they're like, we need a routine. It's time to sleep.
Yes, you can always go to the American Academy of Sleep Medicine. That website, they have a lot of information and resources,
Okay.
and they have plenty of resources for sleep training, as well as, when to get concerned if it's not appropriate. And mind you, there is a field of sleep medicine that just focuses specifically on sleep, and they mainly not only do polysomnograms, which are sleep studies to see how you are breathing, the EEG on your head, and an EKG to look at your heart throughout the night. They also do medications, and they do modifications as well.
So the help is there. And so
Mhm.
that's again our plea and our recommendation is that you talk to your GP, your general practitioner, and you say like, hey, we might be struggling here. And then they can perhaps recommend a specialist at UTMB in the sleep specialty field who can help get you in for those specific sleep studies. I know we've hit on a lot today, but it kind of went by fast. Is there anything else you would like to add as it relates to sleep and parents, or just a general word of encouragement that we will sleep again maybe after pandemic?
So one of the things, I know this sounds more, everyone who's older than me, like my grandmother, my parents, they would say sleep when your children are sleeping, but that's not realistic. You don't want to take a nap in the middle of the day, or you don't want to sleep early. But you need to take care of your health first. As moms and as dads, we tend to be switched on all the time, especially when you have kids. And it is okay to take a break. It's okay to tell your significant other or someone you rely on that I need a break. And caregiver fatigue is real. And we need to make sure if we're at our best, then our children will be at their best. One big point that I wanted to emphasize, and I am a bit passionate about, is the sleep campaign. Back in the 90s, it was called Back to Sleep campaign, and now it's called Safe Sleep.
Okay.
That is on the CDC website if you'd like to look it up. It's about the sudden infant death syndrome that occurs before the age of 1 in children. And it's called sudden infant death because we don't actually know why they just suddenly pass away. And I want to prevent this, especially anyone out there. If one person, this helps them, it means a lot. You put your baby on their back to sleep at night when they're newborns, and up to you keep them in a crib on a firm bed, and no teddy bears, no soft blankets, no toys, nothing in the crib. Make sure there's a fan in the room and there's enough, they have good circulation, air circulation as well. Children, the reason it was called Back to Sleep, we used to have a high infant death rate because children would pass away when they were co-sleeping or they had their teddy bears by suffocation. They aren't able to roll over before the age of 2 months. If they do start suffocating, they wouldn't be able to roll over. And then before the age of 1, that is the main concern. Eventually they can start rolling over and they'll be more careful, but I'd like all parents to keep that in mind. Even though all the decorations are so
Yeah.
cute and you get all these gifts during the baby shower, just you can use them later on, but not before the age of 1.
Thank you for mentioning that. It's incredibly important, and you're right. We get so excited, especially as I mentioned, we had twins, and so I had all the bumpers and all of that, and I took pictures with all their little cute stuff in their crib, and then we took it all out when they came home. because there's already enough stress and things going on with motherhood. I did not need to stress about that happening in the middle of the night. So y'all, please, before the age of 1, nothing in the crib, firm, and the idea of the fan, air circulation, things moving, and co-sleeping. So just don't. And stay safe, Houston. I appreciate your time so much today. You may have cut off my Diet Coke consumption a little early today, but I know my body will be grateful tomorrow. So thank you, as always, UTMB Health, for sponsoring these monthly health series. It is our privilege and pleasure to bring these important topics to you. And as always, in the comments below, we will pop in links so you can find out more about UTMB Health, how to get connected with a general practitioner like Dr. Kalia if you are in the search for one, because we always talk about how that's where health starts first. So thank you all for joining.